Chiropractor Dr. Johnson. We have Brandon here with us this afternoon. Brandon's a weightlifter, as you can see, and we're doing this YouTube video for him because that's how he found out about us. And Sarah, this one's for you. So we're going to have you close your eyes and bend your head forward and backwards for me, and then back to neutral. Now his biomechanics are such that his head is forward, he's got forward hip posture, and is translated a little bit to the right of center. That's why your right shoulder looks lower than your left one, and your right hand looks a little longer than your left one. And then down here, you got a little less room over here than you do on this side, so your pelvis has translated that way as well. Now I've already done his orthopedic neurological evaluation. Muscle strength's good. His reflexes are all normal with the exception of his patellar reflex, which is low on both sides. And he's had knee problems on both sides as well. So let's go ahead and lay on your tummy for me again, Brandon. We're going to get started doing his adjustment here first so I can get a feel for his spinal mobility and joint range of motion. Now in this position, his left leg's a ½ an inch shorter than his right leg, which gets longer when I bring it up, and that tightens up in your low back, doesn't it?
Mm-hmm.
Yep. So he's got sacroiliac subluxations bilaterally, worse on the left, and then L5, and you can see he's had back surgery here at L4, L5, discectomy, laminectomy. All right, so when we get started adjusting your pelvis and low back, and these chiropractic adjustments will not cause any complications with surgical spines like this. Even if you've got screws and plates and rods in there, depending on the time frame of your surgery, you can still safely get it adjusted and help break up some of this fibrotic scar tissue and adhesions that develop following surgery. It's going to be a little sore at first. There. Oh yeah. Yes sir. Crack addicts are gonna love you. Yep. Okay. That's it now. One more right here. Still feel it. Okay, keep breathing out, exhaling. There. Okay. Making me work for it today, Brandon. Okay, legs are even now. This should already feel a little easier than the first time.
Oh yeah.
Okay, good. You're gonna feel your head popping up a little bit on this next one. There we go. There. Good. Okay, let's turn you on your back now. And you drove how far to get here today?
How far is this?
Where are you from? What part of town?
I'm from Pearland.
Pearland, which is way south of here.
Yeah, it's a good 45
45 minutes, yeah. That's still better than flying from New York City.
Oh my God, that's for sure.
Okay, just so you get, I'm just going to check your range of motion. See how that's locked up right there? Locked up right there too. Put your hands right here. You're going to feel your head popping up a little bit. Put down this way just a little bit. There you go. That's it. Good. Okay. Now slide down about another inch and put your arms straight out to the sides. I want to adjust your shoulders, your clavicles, and your anterior rib cage. There we go. Good. Okay. Just relax your legs here. So how long did you watch us on YouTube before you decided to take the plunge?
About 5 episodes.
Okay, just relax this one here. There we go. Should have felt that in your knee all the way up to your back. Okay, let's set you up face this way actually. There we go. Okay, scoot back this way a little bit, please, sir. See, that's where I get my workout every day, all day. Working on guys like Brandon. Just lifting their legs and arms up to work out. There we go. There's your left shoulder and right shoulder. Now we're gonna get your elbows. The wrist, that was a good one. Digits. There. So what attracted you about our YouTube videos that made you want to come here the most?
Probably I saw other weightlifting. I saw a lady come in here. She had she was like bent all the way over.
Oh yeah.
And I watched every one of those episodes. I'm like,
Yep.
That was pretty neat. So I said,
She got straight in about 5-6 visits.
Yeah, I watched some of them. Like, he must know what he's doing, I guess.
Yep.
Come check him out. It's been about 3 years since my last adjustment. So.
Oh, okay. So you have been adjusted before. Now, I'm gonna get this pin. Now slide up a little bit where your hip's right underneath that pin. A little bit more. There you go. Put your hands on your tummy. There we go. That's gonna feel tight and it's supposed to. Just let your legs relax and bend. This is why you're really here, isn't it? The ring dinger.
Mm-hmm. I watched plenty of these too.
Now see, he doesn't have a lot of reflex there in his patellar reflexes before the adjustment. So we're going to adjust him, decompress him, give him his first ring dinger and see if he's kicking any better. Exhale and relax, keep your teeth together, there you go. You should have felt that all the way down.
Yep.
Here, slide down a little bit, there you go. That's it. Okay. Alright, now just relax there for a second. Not much there still. They're about the same. Okay, just relax your head in my hand here. Perfect. Palmer diversified rotary brake. That's it. Should have felt those all the way up and down your neck. That was excellent. Okay, so the next thing I'm going to have you do is come over here and stand in front of the mirror again. I'm going to shoot you. Come all the way up here from South Houston for me to shoot you. There we go. This is an Atlas adjusting instrument, and I'm going to recalibrate your cerebellum. So let's have you flex your head forward and backwards in. Back to neutral. Take a look in the mirror now. See, you're more centered up. You're still a little bit right, but look how much better this is. Let's pull these up and back. Hold those there for me. There's your homework right here. Straight back, and you're right. So see, we want to go left, just like that. Exactly. Look in the mirror. See, I got you straight translated. Now look up at the ceiling. You're going to feel a little tap right there. You're going to feel another little tap right there. Okay, now relax. Now, when you go forward and backwards again, tell me what you feel different. Does that feel any smoother to you?
It feels a lot smoother.
Okay, good. So, walk around and see how that hip feels right now compared to when you walked in.
I'm using my legs even not as much. I'm not using my right as much.
Okay.
I'm not sure about right.
Are you not favoring it?
Mm-mm.
So how would you describe to our YouTube viewers out there about your first experience here at Advanced Chiropractic Relief? Examination, treatment, everything.
It was great. I would highly recommend coming in if you're watching it.
Is it worth your trip up here from South
Definitely worth
Houston?
the trip.
Thank you for sharing your
Thank
experience. Yep. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, home of Super Bowl 51. We'll see y'all soon.